Good afternoon. My name is Kamlesh Kaur, and I'm a public health educator with Stanislaus County Public Health. This is your COVID-19 update for Thursday, August 20th. As of this recording, we have had 12,935 positive cases of COVID-19. We currently have 121 non-ICU patients and 64 ICU patients in our hospitals. We have lost 212 members of our community to COVID-19. Our sincere condolences goes to those who have lost a loved one. Yesterday marked 5 months since the stay-at-home order was passed on March 19th. The graphs on the screen shows the timeline of interventions since then and our infection rates in the blue graph. Public health orders and interventions are meant to slow the spread and prevent adverse outcomes such as death in situations like COVID-19. Our interventions bought our businesses time to prep their workspaces for safer return of their employers to work, and it also allowed our hospitals to assess their situations to meet the needs of our community in case we do have a surge. While many areas in the state and our nation saw an increase in cases during that time, our community did really well working together in containing the spread of this disease. Due to these efforts, our county was able to get the variance attestation approved on May 20th from the state to allow opening of different sectors of our county. This variance was approved because we were able to show that we were ready to open safely. On June 5th, additional areas such as bars, gyms, and hair salons were opened so members of the community can safely enjoy the outdoors and dine out with their family members. However, during this time, we also started seeing larger gatherings that started contributing to our increase in cases. On July 2nd, due to our increased rates in infections, a state and current public health order closed many sectors that had reopened with that variance, including bars and salons. During this time, the state also passed a mandate for face coverings to slow the spread. When we say slow the spread, we want to see less transmission from those who are infected with COVID-19. Since July 2nd, in this graph, you will see that our cases aren't rising as steeply as it did before the second round of interventions. The noticeable plateauing of the curve indicates slowing of the infection rate. However, this doesn't mean that we are out of the risk zone. Our hospitals are still seeing patients who need critical care due to COVID-19. What this graph shows is that timely interventions do work and our actions do indeed make a difference in slowing the spread. This is a preventable disease. We can continue to slow the infection rate by keeping a physical distance of at least 6 feet from those who are not a part of our household. Wearing a face covering, especially in areas where we're not able to maintain a physical distance of 6 feet, can help stop the spread. If you are feeling sick, please stay home except when seeking medical care. Lastly, wash your hands for at least 20 seconds so you don't transfer the virus to others. As a community, we can save lives by being considerate of others. While we continue to address our COVID-19 situation, I also want to acknowledge that the other emergency currently affecting pretty much every member of our community with the current wildfires in the east and west corridors of our county. The wildfire season challenges us as we continue to adapt and respond to COVID-19. Many lives in those areas have been disrupted due to evacuations or loss of property. We are particularly concerned about the increased health impacts with wildfire smoke as it may worsen symptoms or increase risk of COVID-19. If you can smell the smoke and see the ashes, that is an indication that you should be treating air quality conditions as unhealthy and limit your exposure. Limit your outdoor activities, especially children and people with chronic heart and lung diseases. Remain inside air-conditioned buildings. If you do not have an air conditioner, staying inside with windows closed may be dangerous in extremely hot weather. In these cases, seek alternative shelter. If you have asthma or lung diseases, make sure you follow your doctor's instructions about taking your medicines and following your asthma management plan as instructed by your doctor. Call your doctor if your symptoms worsen. If you are an adult, have children, or you have heart or lung diseases, talk with your doctor about whether you should leave the area where we're seeing wildfire cases. In times of crisis like this, prevention and preparedness is the key. Please include your family and your loved ones when you're making plans for emergencies so everyone is aware. Our actions can save lives. United we win.